Lacrimal irrigation. Lacrimal irrigation is a procedure done to rule out any obstruction in the lacrimal system. Dacrology being a major part of oculoplastic practice is essential to have a basic knowledge how the lacrimal irrigation works. So in this video, just wanted to discuss about the techniques and how to interpret the technique. Here in the picture we can see in the first picture we are dilating with the nettleship punctum dilator, and the most preferred one if when you are irrigating, we prefer the upper punctum because the upper cannuculus is the direction is easier to direct our lacrimal cannula. So we prefer the upper punctum and we dilate it with the nettleship dilator, and we can use 1cc syringe or 2cc syringe and a lacrimal cannula and fill it up with normal saline or distilled water. So what we'll do here is we'll direct the lacrimal cannula inside the upper cannuculus till we reach a hard stop, indicating we have reached the lacrimal sac. So when you reach the lacrimal sac, we withdraw a little bit and we can inject, not forcefully, but several parts of fluid. And what we get is we can ask the patient whether the patient has felt something coming into his or her throat. If it is positive, then the lacrimal system is patent and you don't have to continue with anything. But if there is a fluid regurgitating from the opposite punctum, it signifies there is a blockage in the lacrimal system. It can either be a nasolacrimal duct obstruction or a common cannular block. And also one of the findings we can see is that if there's mucoid flakes, until and unless proven otherwise, it is most likely primary acquired nasolacrimal duct obstruction. And if the fluid, if it is clear fluid, we have to do a probing and see whether it's a hard stop or a soft stop. And if it is a hard stop, it is usually a nasolacrimal duct obstruction. If it's soft stop, we can conclude it is a common cannular block. And also, if the fluid regurgitation is from the same punctum, we should suspect there is a cannular block, proximal, central or distal, and we should try from the other punctum area. And this is how we come to conclusion and proceed with planning for our management. Now this short video I'm just demonstrating a procedure technique called ROPLAS, regurgitation on pressure over lacrimal sac. So this test is more than 90% both sensitive and specific, and if you find a regurgitation from the open pressure over lacrimal sac, until unless proven otherwise, it's primary acquired nasolacrimal duct obstruction. So here I'm using a lacrimal cannula and 1cc syringe filled with normal saline, and I'm going through the upper cannuculus and hitting the bone and withdrawing a little bit. Then when I'm doing that irrigation, there is a gush of fluid coming out from the opposite punctum filled with pus, so indicating as primary acquired nasolacrimal duct obstruction.